Hi guys, my name is Stephanie. I'm going to be doing my IRB proposal on calcium supplementation to prevent osteoporosis. Just a quick background. Osteoporosis is the most occurring bone disease in the United States. It affects more than 55% of people who are aged 50 or older. Baby boomers are the most likely to be at risk for developing the disease. And a lack of calcium is linked to being a risk factor for bone disease such as osteoporosis. 99% of the body's calcium is found within the skeleton. When the intake of calcium is lower than normal, the skeleton is used in reserve to meet the body's needs. So therefore, the body takes the calcium out of your bones and uses it for other parts of the body when you're not using enough of it or consuming enough of it. And there's a high risk for Americans to develop osteoporosis due to the average diet only contains 600 milligrams of calcium a day, and the recommended daily dose of calcium is around 1,000 milligrams, or between 1,000 and 1,200 milligrams. As you can see here, most people who need calcium the most are adults that are in the category of 50 or older, just because their bones become weak when they're older and they don't develop it or absorb it as well as they should. Also, usually women who are pregnant tend to need more calcium because they're carrying for two, and their body's using more of it and needs more of it, so their intake is going to be a little bit more than the average person would have. Now, just a little background of calcium. Calcium is a mineral in the body and is used in very many ways. It assists with stabilizing blood pressure, building strong bones and teeth, and the majority of calcium that we have in our bodies is stored in our bones. So for one of the ways to detect if you are deficient in calcium is you have muscle cramps, insomnia, tooth decay, poor bone density, weak and brittle nails. For muscle cramps, you would probably get aches in the thighs and arms all moving or walking around. More insomnia would be a lack of sleep due to probably the cramps that you're having or the pain you are experiencing. Tooth decay, because calcium is not only found in bones but in your teeth as well. And a low bone density is also known for detecting low calcium or being deficient in it. Low bone density causes easy fractures and spasms, and in the worst case it would be rickets would be the cause. And a blood calcium test would be the best to order to diagnose and monitor conditions that are also related to calcium deficiency. So you could also see issues of the heart, nerves, kidneys, and teeth, not just bones. The sources of calcium include dairy products like cheese, milk, yogurt. Also, people tend to think of calcium as just dairy products, but you can also find it in leafy green vegetables such as kale, broccoli. Also, you can find calcium in almonds as well, which is a great snack. And supplements, usually for calcium, are found over the counter and include vitamin D3 to help with the absorption of calcium in the gut. Now, a normal calcium serum level is between 8.5 and 10.2 milligrams per deciliter. As we age, our bones gradually thin as well as lose density. This means we need an increase in our daily requirement for calcium. The high importance of calcium to daily life, so this is why we might use calcium as a supplement. And for example, the amount of calcium in your blood is determined by how much calcium one is ingesting through your diet. So if you're not eating dairy products or any green leafy vegetables, then you're going to be a little deficient in calcium. The amount of calcium in vitamin D actually help the absorption of calcium. Also, when blood calcium levels get low, hypocalcemia, which is hypocalcemia, the bones release the calcium to bring it back to a good level, and when blood calcium levels get high, or hypercalcemia, the extra calcium is stored in the bones or passed out. Symptoms of hypercalcemia is really thirsty. You're going to have a lot of bone pain, weakness, confusion. And then symptoms of hypocalcemia would be muscle cramps, confusion, tingling in the lips and fingers. So watch out for those. Now, when someone has too much calcium in their body, they would result in severe fatigue, also including diarrhea, nausea and vomiting, depression, and too much calcium can also cause an irregular heartbeat and a severely low blood pressure, which is not good. Now, back to the functions of calcium. It makes up for 99% of the human body where the calcium is stored. So 99% of the calcium in the human body is found in your bones. Calcium is also used in the gut, blood plasma, interstitial and intracellular fluids, and most importantly, the bones. Plasma calcium helps with homeostasis and make sure the blood plasma is regulated. Also, it plays a big role in cell signaling and blood clotting, muscle contraction, and nerve function. The calcium supports the skeletal structure because 99% of the calcium found in the body is used for bone strength. So calcium facilitates bone strength by acting as a remodeler, and without the right amount of calcium in the body, bone loss replaces bone growth, which in turn will become more fragile, which would increase the likelihood of a fracture, which also increases the risk for osteoporosis. And when calcium levels are not maintained in bones, it is not just bones that take a toll. Other parts of the body, such as the heart, muscles, and nerves, utilize calcium, and without the correct intake of calcium, it is taken from the bones, which also, like I said before, results in fractures and weak bones. So for this study, there's other studies that were done to compare how supplementing calcium through a pill form or implementing a dietary calcium would affect the developing of osteoporosis. So in 1992, Johnston found that a pill supplement of calcium in children, along with calcium in the diet, increased bone mineral density in children. However, there's not been many studies done just for older age adults. Then in 1989, Griffith concluded that a small calcium supplementation resulted in a small reduction in systolic and diastolic blood pressure. And the effect of supplementing calcium in the diet is at least as great as a non-dietary supplement. So, as you can see, both supplementation and dietary supplementation have a positive effect on calcium in the body. In 2013, Weaver found that calcium supplementation can be linked to cardiovascular disease and may be posing more harm than good. Determining the advantage of calcium supplementation due to either bone or heart health has been an issue due to poor subject compliance and design flaws. Most studies have been known to have subject compliance issues and design flaws. Whether it's people don't want to take the calcium or aren't following through with a study, it makes it hard to develop a strong review and obtain positive results. In 2015, Bolin found that adverse effects probably outweighs any benefits of calcium supplementations on fracture, and neither calcium nor vitamin D supplements should be used for fracture prevention in adults. As for limitations of the study, there are dosing differences, and calcium was used to treat multiple ailments, not just osteoporosis. Also different findings, age of people being treated, so there was children and older adults. Also there's postmenopausal women. Also how long they were being treated for. Some were only a couple months, some were 3 years. And the size of the study was usually between 100 to 200 people. If the size of the study was larger, then we might have found more significant results. So for my proposal, I would like to see what effect will supplementing calcium through dietary means and supplementation will have on developing osteoporosis. My hypothesis is that calcium supplementation through pills and diet will increase one's risk of developing osteoporosis. I meant to say calcium supplementation through pills diet will help decrease the risk of developing osteoporosis. Little typo. And the point of research is to determine whether supplementing with both the pills or just dietary calcium will affect the development of osteoporosis, and to determine whether there is a difference with bone density with subjects who are already developing osteoporosis. Patients will be recruited from Boston General Hospital. A retrieve a baseline calcium test and bone density will be measured by a DEXA test. There will be a control and intervention group. The intervention group will be given calcium supplements to take orally and given a dietary supplement too, where it will be either milk, cheese, green leafy vegetables, etc. There will be a follow-up 4 months after the supplementation has been given out, and results from each group will be compared. Subjects will be admitted to Mass General Hospital in the endocrine and bone density unit within the past 3 years. That's how we will be choosing the subjects. A medical screening will be done, which will include a physical exam, intake of family history, and history of the patient, along with a review of the patient's symptoms for osteopenia or osteoporosis. Subjects will be chosen ages 40 to 60, both male and female, due to calcium being a lack in one's diet at this age. And all research will be performed at this site. Researchers, dietitians, doctors, and subjects will be at this location. And confidentiality will be maintained. Every aspect of the study will be kept safely on a laptop of the researcher provided by UNE, and everything about the subjects after the study is complete will be shredded. As for my data analysis, nominal data for age, gender, ethnicity, a recommended daily amount for calcium intake, and measurements to be continued throughout the study will be bone density, a calcium test, daily food log of what the subjects will be eating, and making sure that they're taking their supplements. With this study, there will be a few contributions for the field of work, such as increasing how often one performs a bone density exam to help maintain current T-scores and keep them above osteoporosis range, and to improve calcium absorption through dietary calcium and calcium supplementation through a pill, and realizing that supplementing with both mentioned above will increase bone density and reduce the risk of developing osteoporosis. And there are my references. Thanks, guys.